So in general, this isn't my favorite type of lifting. So she's talking about a breast lift where you make a large incision in the crease of the breast. Sometimes people will call this scarless. It's not. It's a large scar, and then a incision around the areola or the nipple. I don't like this method of breast lift for patients with and without implants. So patients without implants, this often leads to a boxy, more flat appearance of the breast. The breast does not typically look as round from the side, and you lose a lot of that beautiful natural breast shape, so it's not my preference. Sometimes people will be tempted to use this when you have an implant that's bottomed out. So if the nipple is sitting where it should and the implant has dropped too low, this usually is happening for a very specific reason. It's because the patient is not a good capsule former. So the scar tissue sac around the implant is too weak to support the implant, and so the weight of the implant stretches the lower pole of the breast. And yes, if you cut off that lower area in the crease, it will look good right away, but the same problem will happen again because you haven't solved the issue. And the issue is that the patient just doesn't make thick capsule. And so you need some kind of support internally to support the implant to prevent that problem from happening. Now, if you have that problem and you're removing an implant, I like to do something called an auto-augmentation, where I will utilize that lower pole, I'll deepithelialize it, tuck it up and in underneath the middle portion of the breast, and you can use that portion of lower tissue to actually augment the breast and give a nice shape. So I do like to do that, but it's not typically my preference for a primary breast lift, because like I said, I don't care for the shape that it gives.